Thank you. Good morning. These are my disclosures. The purpose of the study was to assess the safety profile of cyclic aspiration compared to continuous uniform aspiration in an animal model. I'll start off with a little bit of background. Achievement of a TICI-3 first pass effect during mechanical thrombectomy is associated with improved good clinical outcomes as well as reduced mortality rates in patients at 90 days compared to non-first pass effect cases. However, the first pass effect is only achieved in 24% of the cases in many clinical studies. However, there is no difference in achieving first pass effect between stent retrievers and continuous uniform aspiration. Emerging evidence shows that the varying pressure dynamics of cyclic aspiration can improve recanalization rate in experimental models. This work was done by the UMass group. They published in the SVIN meeting last year and recently published in the JNAS journal. They showed that cyclic aspiration significantly reduced the rate of clot fragmentation and distal emboli formation in the flow loop model. Further, they showed that the complete clot ingestion into the aspiration catheter was significantly high in the cyclical aspiration. About 50% of the clots ingested into the catheter, whereas none was noted in the continuous uniform aspiration. Similarly, the partial clot ingested in the catheter, a twofold increase in the length of clot inside the catheter was noted in cyclical aspiration versus continuous uniform aspiration. Further, the use of continuous uniform aspiration in small vessels using a big bore catheter can lead to vasospasm or vessel collapse due to the snug fit of the catheter in the vessel, and also the continuous negative suction generated is not proportionate to the vessel diameter. So the cyclical aspiration can overcome a lot of limitations associated with continuous uniform aspiration. In order to test the in vivo safety of in vivo cyclical aspiration, we used rabbit distal aorta vessels. The distal vessels in the aorta are similar in diameter to that of human intracranial vasculature. Here is an example of a 3D RA image of rabbit distal aorta. You can see the arteries. The rabbit aorta is similar to human carotid artery. Common iliac artery is equivalent to basilar artery. Common femoral artery and superficial femoral arteries are corresponding to M1 and M2. Further, the bifurcation seen in the rabbit distal aorta is somewhat similar to human intracranial vasculature bifurcations. The study design, we used 6 New Zealand white rabbits weighing about 3 kilos. We had about 6 to 7 target vessels per rabbit. Then we had a total of 37 target vessels, which were randomized into 3 treatment groups. Cyclical aspiration was used in group 1. We used a digital clear aspiration system from Insera Therapeutics. Group 2, we used penumbra continuous aspiration. And then group 3, we performed with Insera clear aspiration with continuous uniform. So we had about 12 to 13 vessels per group and 3 passes per vessel. All the procedures were done using right carotid artery. Intra-arterial angiography was performed at baseline as well as immediately post procedure. At 30 days, intravenous non-invasive follow-up was performed, and terminal follow-up was performed at 90 days, and tissues were harvested for cross pathology and histopathology. Continuous uniform aspiration was performed with the high at negative 29 inches of mercury, whereas cyclical aspiration was done with the high-low settings. The angiographic safety endpoints included vasospasm, vessel thrombosis, distal emboli, and vessel dissection. The vessel pathology safety endpoints included thrombosis or vessel injury at the gross level, and endothelial injury, thrombosis, and vessel injury at the microscopic level. So we used commercially available catheters. The catheters were chosen based on the target vessel diameter. Here is the vasospasm was assessed using a semi-quantitative 4-point scale. On the left side, we can see a severe vasospasm immediately after the procedure in the right common femoral artery. On the right side, we can see the vasospasm was resolved at a 30-day follow-up, showing normal vasculature. The gross pathology was correlated with the target vessel. The target vessels were dissected and mounted on the slides, stained with H&E. The vessel pathology scored by a 5-point semi-quantitative scale. We observed persistent vasospasm, defined as vasospasm present at the end of the procedure on day 1 in 56% of continuous aspiration cases versus 12% in cyclical aspiration. Mild narrowing persisted in day 30 in vessel 1 of continuous uniform aspiration. No adverse events persisted on angiography or histopathology at 90 days in all the experimental groups. In summary, cyclical aspiration has an improved safety profile compared to continuous uniform aspiration at the time of the procedure. Cyclic aspiration has a substantially equivalent safety profile to continuous uniform aspiration at 90 days. Minimizing persistent vasospasm at the time of stroke thrombectomy procedure in the setting of cerebral ischemia has clinical implications. Appreciate your time. Thank you.
Thank you very much.